7 silent health problems affecting seniors after 60. The problems no one talks about after 60. Life doesn't suddenly fall apart. There's no alarm, no flashing warning sign, no dramatic moment that says something is wrong. Instead, things fade quietly. Energy lowers, sleep changes, memory slips, balance feels off. And most seniors brush it off with one sentence: it's just old age. But here's the truth. No one explains clearly enough. Many of the biggest health problems after 60 don't hurt. They don't scream, they whisper. And by the time they're noticed, they've already been there for years. This video isn't about fear. It's about awareness. Because when these problems are caught early, they're manageable, treatable, and sometimes reversible. Today, we're uncovering 7 silent health problems affecting seniors after 60, issues that often go unnoticed, undiagnosed, and untreated. Not because they're rare, but because they're quiet. Let's begin. 1. Sarcopenia, the silent loss of muscle. Most people think aging means losing weight. But after 60, the real danger is losing muscle. It's called sarcopenia-related muscle loss, and it happens slowly, invisibly, year after year. You don't wake up one morning weak. Instead, you notice things like standing up from a chair takes effort, carrying groceries feels heavier, stairs seem steeper than they used to, balance feels uncertain, and again, people say, I guess I'm just getting older. But muscle loss is not just about strength. It's about independence. Muscle protects joints. Muscle stabilizes balance. Muscle keeps metabolism active. Muscle prevents falls, the #1 cause of injury and disability in seniors. Here's the dangerous part. By age 70, many adults have lost 30 to 40% of their muscle mass, and most never realize it's happening. Why is sarcopenia so silent? Because it doesn't cause pain. It's because weight on the scale may stay the same. Because fat replaces muscle and hides the loss. But the body feels it. Less muscle means slower walking speed, higher fall risk, lower immune strength, poor recovery after illness, increased risk of hospitalization. The good news: muscle loss is not inevitable. Even in your 70s and 80s, muscle can be rebuilt with light resistance training, adequate protein intake, regular movement, vitamin D, and strength-focused routines. The tragedy is not aging. The tragedy is thinking weakness is normal and doing nothing about it. 2. Osteoporosis, weak bones, no warning bones. Don't scream when they weaken. They stay silent till they break. Osteoporosis is one of the most underdiagnosed conditions in seniors, especially women after menopause, but men too. Bones slowly lose density. They become porous, fragile, brittle, and you feel absolutely nothing. No pain, no stiffness, no symptoms. Until one day, a small fall leads to a fracture. A simple twist cracks a hip. A cough causes a spinal compression fracture, and suddenly life changes. Hip fractures after 60 are often life-altering. Many seniors never fully regain independence. Some never walk the same again. Why osteoporosis stays hidden? Bone loss happens internally. Height loss is gradual, posture changes slowly. Fractures seem accidental warning signs people ignore. Losing height over time, stooped or hunched posture, back pain with no clear injury. Fractures from minor falls. Bones are living tissue. They respond to weight-bearing exercise, strength training, calcium and vitamin D, hormonal balance, proper nutrition. Yet many seniors are never screened until after a fracture. And that's the tragedy. Osteoporosis is preventable and treatable before it breaks you. 3. Chronic dehydration, thirst that disappears with age. 1 of the most dangerous myths about aging is this: drink when you're thirsty. After 60, thirst signals weaken. The body simply doesn't ask for water the way it used to. So seniors slowly walk around chronically dehydrated without realizing it. No dramatic symptoms, no obvious signs. Just fatigue, dizziness, confusion, constipation, dry mouth, headaches, low blood pressure. Dehydration increases risk of falls, kidney problems, urinary tract infections, cognitive confusion, medication side effects. And here's the dangerous loop. Some seniors intentionally drink less water to avoid frequent bathroom trips, which only makes everything worse. Mild dehydration can feel like anxiety, brain fog, weakness, irritability, often misdiagnosed as dementia, depression, Low blood sugar hydration is medicine. Simple habits make a massive difference. Drinking small amounts, regularly eating water-rich foods, limiting excess caffeine. Monitoring urine color, making hydration routine, not optional. Water doesn't just hydrate. It protects the brain, kidneys, heart, and balance system. 4. Hearing loss. The invisible isolation hearing doesn't disappear overnight. It fades. Slowly. Quietly. Unnoticeably. You start asking people to repeat themselves. TV volume goes up. Conversations become tiring. Eventually, many seniors stop engaging. They smile. They nod. They withdraw. Untreated hearing loss is not just an ear problem. It's linked to cognitive decline, dementia risk. Depression, social isolation, faster brain aging. Why? Because hearing stimulates the brain. When sound disappears, parts of the brain go underused. Many seniors delay hearing tests for years because there's no pain. They think hearing loss is normal. Hearing aids feel embarrassing. They don't realize how much they're missing. But untreated hearing loss shrinks social life and brain health. Modern hearing care is discreet, advanced, and life-changing. The earlier it's addressed, the better the brain stays connected. 5. Sleep disorders, when rest stops restoring, partially covered here, continued in part 2 after 60. Sleep changes, but poor sleep is not normal aging. Many seniors struggle with frequent night waking light, unrefreshing sleep, early morning waking, daytime fatigue. Sleep disorders often hide behind excuses. I'm retired. I don't need much sleep. But sleep is when the brain clears toxins, repairs neurons, regulates hormones, consolidates memory. Chronic poor sleep increases risk of heart disease, diabetes, dementia, depression, weakened immunity. Sleep problems deserve attention, not acceptance. Pause. We've covered 5 silent health problems so far: muscle loss, bone weakening, chronic dehydration, hearing loss, sleep disorders, and we're just getting started. 5. Sleep disorders, when rest stops restoring. Sleep after 60 isn't supposed to feel like survival. Yet for millions of seniors, nights become something to endure, not enjoy. They lie awake staring at the ceiling. They fall asleep easily, then wake at 2 or 3 a.m. and never fully return to rest. They sleep 8 hours but wake exhausted. And slowly, quietly, poor sleep begins to shape their health. Chronic sleep disruption affects blood pressure, blood sugar control, memory formation, acute emotional regulation, immune response. Lack of deep sleep accelerates aging at a cellular level. But many seniors never mention sleep issues to doctors because they assume it's just aging. They don't want sleeping pills. They've lived with it for years. Common silent sleep disorders after 60 include insomnia, sleep apnea, restless leg syndrome, circadian rhythm shifts. Sleep apnea, especially, often goes undiagnosed. It doesn't always look like loud snoring. Sometimes it shows up as morning headaches, daytime sleepiness, memory problems, mood changes, poor concentration. Every night of poor sleep is a missed repair cycle. But better sleep is possible with light exposure during the day, consistent sleep schedules, reduced evening screen time, gentle physical activity, proper breathing, and sleep evaluation. Sleep is not a luxury. After 60, it's a medical necessity. 6. Cognitive decline, the changes that begin long before dementia. Cognitive decline doesn't start with forgetting names. It starts years earlier, silently, slower processing, harder multitasking, needing more effort to focus, losing words mid-sentence. Most seniors brush this off as harmless. But cognitive decline is a spectrum, not a switch. And what's frightening isn't dementia itself. It's how long the early stages go unnoticed. The brain changes quietly through reduced blood flow, inflammation, insulin resistance, sleep deprivation, sensory loss, especially hearing. By the time memory loss becomes obvious, damage may already be advanced. But here's what research consistently shows. The brain remains adaptable well into old age. Cognitive health is deeply connected to physical movement, social interaction. Learning new skills, proper sleep, nutrition, hearing, and vision care. Mental decline accelerates fastest with isolation. When seniors stop talking, learning, engaging, moving, the brain follows. Warning signs that shouldn't be ignored: frequently losing track of conversations, difficulty planning or organizing, repeating the same questions, struggling with familiar tasks, increased confusion under stress. Early intervention doesn't just slow decline, it can preserve independence for years. 7. Depression and emotional loneliness. The quietest crisis of all this is the health problem no one wants to talk about, because it doesn't look like sadness. Depression after 60 often appears as fatigue, irritability, withdrawal, loss of interest, apathy, physical complaints, not tears, not crying, just fading. Many seniors experience loss of purpose after retirement. Loss of friends and spouses, reduced social roles, feeling invisible, feeling unnecessary, and society often reinforces this silence. You should be grateful. Others have it worse. You've lived a full life. But emotional pain doesn't expire with age. Your depression increases risk of heart disease, cognitive decline, weakened immunity, poor recovery from illness, early mortality. Loneliness is as harmful as smoking, and yet it's one of the least addressed health risks in older adults. The most dangerous phrase a senior can say is, "I don't want to be a burden." Connection is medicine. Purpose is medicine. Simple interventions save lives. Regular conversations, meaningful routines, community involvement, physical movement, emotional validation. Mental health deserves just as much care as physical health at every age. Why these problems stay silent? These 7 health issues remain hidden because they develop slowly. They don't cause immediate pain. They're dismissed as normal. Aging seniors minimize their symptoms. Families miss subtle changes. But aging's not supposed to mean suffering quietly. The body speaks in whispers before it screams. Listening early changes everything. The most important truth about aging doesn't take health away all at once. It takes it gradually, unless we intervene. The goal after 60 isn't youth. It's function, it's clarity, it's independence, it's dignity. The difference between aging well and aging poorly is not luck. It's awareness, it's action. It's early care. Final message for seniors and families: if you're over 60, you're not weak, you're not fading, you're not done. Your body still responds. Your brain still adapts. Your life still matters. And if you're caring for someone over 60, pay attention to the quiet changes. They're not complaints, they're signals. The earlier these silent health problems are addressed, the longer independence lasts, the richer life remains, and the more aging becomes something to live through, not endure. A call to awareness: aging doesn't have to be loud to be dangerous, but it also doesn't have to be silent to be solved. Awareness is the first treatment. Movement is medicine. Connection is healing, and knowledge is power. After 60, the body whispers, the smartest thing we can do is listen.